to our YouTube channel following today's meeting. So if you don't want to be recorded, you may disengage now. All right. So good morning, everybody. Again, as an administrative note, please mute your phone if you're not talking. And when you are talking, please unmute. We're going to thank you guys again for taking time out to start joining back up on our monthly traditional meetings. Got a decent amount of stuff to discuss, not too much craziness. I want to give you guys an opportunity to discuss things that you guys may want to share with the rest of the coalition as well. So we'll do a quick rundown of participants that we do have on the call this morning. We'll start with our hospitals, and we'll start with Anderson.
Eric's here.
Thanks, Eric. Alton.
Hey, Phil, it's Ashley Spear and Brian Lidke.
Hey, good morning. Boyd.
State Route 15, Jefferson Road, Belleville, for debris in the roadway due to an accident with the deer.
All right. Carlinville Area Hospital. Staunton.
This is Sue. We're here.
Gotcha, Sue. Fayette County Hospital.
This is Tina Evans, and I'm here.
Good morning, Tina. Gateway Regional.
Hi, this is Rick Wolf. I'm here.
Morning, Rick. HSHS Holy Family. St. Elizabeth's.
Brad Perry's here.
Gotcha, Brad. St. Joseph Breeze. And Highland. Jersey.
Jersey's here.
Gotcha, Jersey. Got myself, and I think even though Lee is on the road, sometimes he tries to join in, but me from Memorial. I know we got Scott Klosterman on as well. Not sure if Leanne was able to join this morning. Leanne, are you on?
I am.
Buenos dias. Once again, Memorial Chester.
Georgia Allen is here.
Thanks, Georgia. OSF St. Anthony's. Redbud Regional. Sparta. And Touche.
Hi, Phil. Eric's here.
Hey, Eric. How are you? All right. Our health departments, Bond County.
Terry, I'm here.
Gotcha, Terry. Calhoun County. Clinton. Mila, I believe we already got Mila on. Still Eastside Health District, Mila?
No, St. Clair County Health.
St. Clair County Health.
Okay, now St. Clair County. All right. So Eastside.
San Croix Slough.
I'm sorry.
Eastside is Elizabeth and Charmaine.
Gotcha. Welcome. All right. Fayette. Greene County.
Green's here.
1 minute.
Jersey.
Heidi's here.
Hi, Heidi. Macoupin County.
McCoupin's here.
Gotcha. Madison.
Michelle's here.
Gotcha, Michelle. Monroe County.
Vicki here.
Randolph County. And we got Mila on from St. Clair County, roundabout way. Anybody else from St. Clair County on? 'Cause I heard like 3 voices.
Phil, this is Helen Sankoff from St. Louis County.
Oh, hey, gotcha. Hey, Helen.
Hey.
All right. Our community partners list, our REMSC. Greg, are you on?
I'm on.
Good morning. Beth, are you on? Emergency Response Coordinator? Any BJC partners? Local emergency management agencies? MedStar Ambulance?
I'm with you, sir.
Gotcha, John. We got Helen already. Scott Air Force Base. And anyone from STARS. All right. Well, we'll go ahead and.
Willow Weber from Boyd.
Hey, gotcha, Nancy. We'll go ahead and get started. We're going to kind of use just our traditional, even though this isn't our quarterly, we're going to use our traditional agenda just to kind of lead us through today before we get to just some of the things that I wanted to discuss. So I wanted to give an opportunity on, and just before we give an opportunity for that, any other folks on there on the call that I have not called up? No? Okay.
Hey, Phil, it's
Yes.
John Nowak. I got a real quick question, sir.
Sure.
Is this strictly a conference call, or is this still computer aid?
It's both. So, yep, you can join via the guest link. And I see Scott's on it and Eric are on it. So, yeah, you can join via the guest link on your Teams account as well.
Because I could not get on it this morning.
So, again, that's why I was saying
dark
that.
night.
Yeah, that there seems to be a conflict between the two. I will try to go back through and delete them because there's something that's just really mixed up with our BJC teams and our coalition teams account. So, and I apologize for that. I'm trying to rectify it.
So,
Yeah.
so
Nope,
Phil, just
not a
so
problem.
you know, and it's clear in case you guys aren't getting that, in addition to the appointment that we've all saved, it's incorrect on the website. The reminders we are getting are also incorrect. So we're getting, reminders right before the meeting that are incorrect. So yeah, I think it all needs to be completely cleared out of everything, and the reminders need to be cleared out and started over. Just
I agree.
so you guys
So
know.
what I would recommend for everybody, just clear off your calendar, right click on the one that you have today that may be recurring. Just check your calendar going out forward, delete those, and look out for the newest one. Again, sometime either today or tomorrow, I will try to go through and create a new sole invite. I'm just hoping that there's still, like in this meeting itself, I have 2 sets of meeting notes in this specific one that I created. There's 2 conference pins, and that shouldn't exist. I don't know why, but it's that other conference pin is from another BJC conference, which is just odd. And these are things that I can't copy, like right click, copy and paste. It just happens. So I will fix that today. So
Yeah,
going
one of them
forward,
that I still get is the Skype. For some reason, I canceled that Skype a long time ago, but I'm still getting that Skype reminders.
yeah, and Skype doesn't even, we don't even have Skype anymore, so I don't even know how to get rid of that. I'm sorry. So we'll go ahead and just start quickly with IDPH. Greg, you got any announcements?
The only thing that I really have is the same thing I told the EMS meeting today. So we've moved into phase 4 of the restore plan on Friday. And so IDPH is very aware of the rising numbers in other states that have opened quicker than Illinois. So please make sure the numbers that you're submitting to EM Resource and all of that are accurate, and please make sure that that's occurring also on the weekend. They've had some where they see the numbers go down on the weekend because some facilities aren't updating their numbers. So just a reminder to everybody that those numbers are very important. They're watching them very closely. And
Hey, Greg,
that,
can
believe is- yeah.
I'm sorry to interrupt, but this is Georgia, and I found out yesterday and the day before, contact with Ashley Thiel and Dan Lee, that the app on our phones for EM Resource is not including COVID positive in non-ICU beds. So if you're using the app, which is what I was doing on the days I wasn't in the office, that number is not being included. So they have a work order in to try to fix that. But until it's fixed, you need to watch out for that.
Great information. Thank you.
Greg, this is Tina. For EM Resource 2, I did email Dan Lee this morning. I did go in, was able to to remove the CNN number, but the other number will not come out of our system as of, today. So I was unable to remove that also today. I did screenshot what it did on our side of the EM resource to send to him. I don't know if anybody else had that issue or not.
And that's great to know too. So yeah, if you have those kinds of technical things, Dan Lee is the person. It's great to send him a screenshot if you don't understand it, because I think that helps him answer those questions a lot quicker.
Greg, do you
That's
know if,
all I have.
Greg,
Go ahead.
do you know if they're going to take out, because yeah, I'm in there now, and that's very the same thing that I received. It does give you an error when you're trying to take out the NHSN number. So I went in there and just put like a 0, and it takes a 0, but it just won't take a blank, it looks like. So
Okay.
yeah, and it won't take a dash or a letter, but it will take a 0.
And Phil, you're right, it will take a 0, and I did that last night, but then I did the 0 today, but it's still populated. It's on the EM resource, some numbers that go along with that. So I'm not sure where that's getting reported to, and it might be inaccurate.
Yeah.
Okay, I'll let him know that too.
So Greg, again, thank you for that reminder. Yeah, we did have a few issues, and I did talk with Dan, I think yesterday or day before yesterday as well. No, I talked with him yesterday. He was concerned that we had showed a drop off and a spike with our numbers, and I'm going to say specifically here at Memorial Hospital Belleville. And we did have a day where, I'm glad that folks are looking at it, but we did have a day where someone forgot to update, and it would just so happen to be on Monday when I was not in the office, and I normally try to check them daily, but I was off and didn't check. So they are looking at those values and are trying to use those to better coordinate these phases and when someone should or when we should go back and forward between the phases. So please make sure those numbers are as accurate as possible. I do know that there are some instances where we have corporate entities updating the numbers instead of the actual hospitals themselves. So please be cognizant of that if you do have one of your corporate offices updating that information, because we have had instances where that information was wrong and had to correct it the day of. So, and again,
Phil?
just as a friendly reminder, if you aren't talking, please make sure that you're muted. We are getting some background feedback from a few places on the call right now. Go ahead.
Phil, another swing which we encountered is that we're utilizing our own HSHS for doing our testing, and our turnaround time is usually 6 to 8 hours. And when we ran out of some media, we had to go to IDPH, and that went to a 72-hour, and that created a big swing in the numbers when it accelerated our PUIs because we were simply holding on to those. So that occurs occasionally too, that there's just nothing we can do about. So when we see some of those swings, it may be related to just the amount of time that it takes for us to get our results back and get them posted.
Understood. Thanks, Brad, for that. We've seen that across the state with some of the state's numbers as well, where there may have been a delay. So you may have testing seems to be pretty consistent, but you may have a gap of when results were returned. So you may have a higher, not a higher positivity rate, but maybe just a higher overall number of tests that we see within the community. So as I send out those graphs, I don't send out any of the IDP or the local health department graphs, but except internally when we review them. So if you are seeing some of those spikes in number of tests or results that come back, that may be it as well. So best to look at most of that over time anyway to see if there's any real trends going on. Okay. Any other questions for Greg? No? Okay. Was anyone on from STARS, just to give you opportunity to discuss anything going on? Nope. Okay.
Hey, Phil,
Yes.
it's Greg again. I apologize. I guess Beth is not on. I will say that when we talked last week about NDMS and evacuations to our region, we have not gotten the word back from the state, not for a lack of trying. I know another reminder was sent up this morning up the chain to try to get some feedback from the governor's office and the Chicago area. So I just want you to know that's still on the back burner, and we have not received any information, but we are pestering them right now to try to get some feedback from them.
Thank you for that, Greg. And just so everybody's aware, if you weren't on the call last week, HHS is trying to prepare us all for the potential that if we were to have a tropical storm or hurricane in the Gulf or Eastern Seaboard, Southeastern Seaboard, where we may have to evacuate those regions, and normally they would come to somewhere in the Midwest, and we've been hit with that before. They want us to not take our eye off the ball, that we have to walk and chew gum at the same time. Yes, COVID is still a thing, and will be a thing potentially throughout all of hurricane season through November. So they want us to be ready, and so those questions are being asked now. So you may see more and more traction with that as the months go on. Thanks again, Greg, for that. I don't think we had anyone on from STARS, so I know Mike is out. I don't know if he joined on later from REMERT. Mike, are you on? Any REMERT updates by chance? Hey, John. Nice camera work there. I see you.
Phil, I can probably help with some of the REMERT updates if Mike's not on.
Nope, he's not. Go ahead, Leanne. Thank you.
So we have the training scheduled this week with more education on the Tom Mannequin so that we can deploy it out to assist with stop the bleed training, officer down training, things like that. They did an exercise with ILEA last week, which I heard really great things about. And of course, our two big training deployments for the summer were canceled with ISP. Yesterday, there were 2 alerts on a propane tank and water rescue, neither of which called for a full deployment of our team. SES handled most of that.
Awesome. Thank you for that, Leanne. REMERT is constantly working in the background. We are also trying to, from an SES/REMERT, from a Special Emergency Services /REMERT perspective, we are also trying to get our REMERT folks on our medical documentation system, ESO, and everything as well in the background to help them better utilize both the training that they get and be able to document that, go back and look at what we instilled in a more, a more controlled manner. As an EMS non-transport, REMERT, doesn't have a lot of the same requirements as a transport agency would, but they do have documentation requirements, and we want to encourage them to use that and try to get the feedback that they need from the physicians when we do have a patient in the field, so we can better educate and train our team going forward. So that's also going on in the background. So thank you again, Leanne, for that. Sue, I'll toss it to you quickly. Are there any updates from Disaster Mental Health by chance? I'm going to take that as a no, Sue. So I will always make a plug for it, and I hope that you guys are still able to use the resources that Dana put together. So if you have any questions with regard to that, you can always hit Dana up or myself. So I'm going to roll right into grant status.
Hey, Phil, are you there?
Yes.
I'm so sorry. I accidentally hung up when I was going to unmute.
Hey, it's okay. I do that often.
I'm like, dang it. No, nothing updated with the mental health. I have not heard anything from them other than when we got that revised list that I shared with you of the downgraded numbers of people that were available, but nothing since then.
Okay. All right. So grant status, few things. I would say few things would be putting it kind of light. But as you know, just as an update from what we did talk about during the 1 June meeting, we did receive a no-cost extension and some additional funds, okay? That pushed our total award upwards to $816,000, almost $817,000 total for the region. So, I implored you guys to please execute. You guys did a great job at responding to that and getting what you could knocked out by the end of the year. I do know that we still had some outstanding issues with regard to, so I'll use Anderson for an example. We wanted to do the dedicated infection control officer training. COVID hit, we were unable, it took a while to get the grant, then COVID hit, unable to do face-to-face courses. Basically, we had 10,000 sitting there that Eric couldn't put to work. He had some travel that he couldn't go to. So Anderson didn't have any money to spend. Some instances we had where things were OBE or overcome by events, obviously COVID, where we had travel and folks wanted to reapportion their funds and say, hey, instead of spending that money here on travel, I want to now spend it in supplies. We did get some executed amendments to your subawards done. Those are great. But again, in that amount of time crunch, there were some difficulties in some areas where we did not successfully reallocate those funds and give you an opportunity to spend them. So with this NCE, we're going to still try to press forward and get those funds spent. So if you did not, if you were unable to spend your funds by June 30, which was yesterday, we're going to try to work with you guys to make sure that you're still able to spend the funds and execute on whatever that project was. Now, that may constitute Memorial Hospital Belleville executing on whatever you had in that project submission. And again, I'll use Anderson as the example. When we're able to hold face-to-face courses, we're still going to try to have that infection control officer training course, because we know we need that here in the region. We identified it as something we needed in the region, and we're still going to do it. Only thing is that we're not going to go back and do another subaward with Anderson Hospital. We're going to be able. I'm going to mute whoever that is if I can. Stand by. Okay. So we're going to have to execute those funds for the organization. So what that basically means is we may work with Eric to schedule it, but we're going to be the payer of that course. And that's the way we'd honestly like to move forward with most trainings, because it becomes kind of a back and forth thing between the organization and getting paid and stuff like that. So sometimes it's probably just best that if it's a regional training, not something just specific for your organization that you're trying to get done, but if it's a regional training course like this course would be, we're more than happy to carry those over the line and get them paid for. But we'd ask that you, if you're going to host it potentially, or you as the organization, appoint someone to use that schedule and manage the schedule with the vendor. So those type of things. We did have some, I would say, very last minute requests for changes that did not go through, I believe. So again, we're going to still try to work with you as best as possible. So there may be a few subawards that will move forward under this no cost extension. As of right now, I don't have a total amount of what was not spent across the entire board for all the subawards and everything that we spent, and what's remaining with the additional 241,000 that we did receive. So as soon as I know that number, I'll know what else we can do with that. So hopefully I'll have that before our next meeting, and provide some communication out on what steps we need to take to move forward to execute on those dollars. As I asked last month, I do ask you all to try to remain regionally focused and try to best use those dollars that's going to give us the maximum impact across the region. There are several things that we need to kind of relook at, and we're going to do maybe 1 or 2 workshops to help redefine that, just so it's not myself, Lee, Scott, and Leanne coming up with ideas, and Mike Gilbert here coming up with ideas. We want to make sure that we're getting the feedback from you as to what we need to change, and we're gonna be taking apart our what we did is our 5-year plan. I think it was 2 years ago, as far as where we're going forward with preparedness. It was our strategic plan, which you can pull right down off the website now and take a look at. A lot of that had to do with earthquake preparedness, KIMPAC, and pandemic planning. So 3 things that we were working towards, and pandemic being one of them, that we probably want to put a little more focus on going forward. Now, with that said, with this no-cost extension, there were some additional deliverables. So there were some things in there that we had to do that they basically said, all right, we understand COVID happened, so we're taking those things out. Okay, we understand that you were unable to execute on them because you're a healthcare agency and all of your work has probably been going towards COVID since late February, early March till today. So they've asked us to redo some things. In there, I will tell you, I think we received this, Greg, correct me if I'm wrong, we received our amendment on, I think, either Thursday night or Friday night, and a request to update our multi-year training and exercise plan in SIMP by 1 July 2020. I thought that was a typo, but nonetheless, myself and Lee, when I saw that, and I was off on Monday, so I came in Tuesday, and we made some updates to the MyTEP going forward in our 20 to 2021 year. So you can actually visit that and take a look at that inside of SIMP today. If you go into SIMP, you can go into the MyTEP and look under Region 4, and I'll flash that up here now, and you can kind of see what's out there in that MyTEP. So just changing that year from the 2019 to 2020 to 2020 to 2021, and you'll see all the things that we added in there. There was specific language within our no-cost extension that required us to include pandemic training and exercise stuff and planning within our MyTEP. So I went ahead and made some of those adjustments. Kind of had to make executive decision to do that. Couldn't pull everybody together to get everybody and say, hey, what do you want? What do you want to have? So we put some things in there. We had 2 classes that were actually scheduled, but then canceled because of COVID. One was a pandemic preparedness course. One was a PPE course for high consequence infectious diseases. So those are 2 that we just left back in there, but I do believe we added a few other workshops and stuff like that to that. So you can go inside of SIMP today and take a look at what we did add. That's not etched in stone, that can be changed, but we wanted to make sure we were able to meet that deliverable. So I made sure that was done yesterday. A few other things that we have to do: validate our pediatric surge annex via standardized tabletop exercise. So we have to do that by September 30th of this year. We have to do a KIMPAC communication exercise. So that was something that was in the previous, but they just extended that for us, and we were going to get that all done during our April 27th KIMPAC full-scale exercise. However, obviously we had to cancel that, and we were going to try to get that back on the books. We put in a tentative date for our full-scale KIMPAC exercise, as we have to get one done by 2022. We have just put a tentative date in there for, I put 27 April of 2021 as just a tentative date, based on the feedback that you've all provided, or the region provided, that we still wanted to get that full scale. We wanted that full scale exercise as a part, as a region that we've been working towards for so long. We don't want that to go to waste. So we're going to do that. And that will probably entail us redoing a few of the steps that we've already done and still some of that coordination. But we're going to get there. I promise you that. We're going to knock that out when COVID's all washed away, I'm sure. Also asked us to review our Regional Healthcare Coalition Preparedness Plan. Now, the way ASPR uses the word preparedness plan and response plan and everything is somewhat different than what they do in the EMA world. So when they talk about this preparedness plan, this is that strategic plan that I talked about previously, and that was our 5-year plan, which again, you can go out on our website and get to that and pull that down and take a review of that. So they want to update to that, and there are some COVID specific language that they're asking us to kind of to do with both that and our Regional Medical Disaster Response Plan. Again, it has COVID specifics in there as well. So, and when I say that, just so you guys understand what that, I'm going to pull it up quickly, what that really entails. Here, give me a quick second, and I will, because I've been scrounging this document all morning just to make sure that I didn't miss anything, but forgive my typing. All right, let's see. So I'll give you some of the language here. So for those of you who are online who can see this, I'll read it to everybody else who's just listening, but it basically says the Regional Medical Disaster Response Plan must be updated by 31 December 2020. And then some of the sub-elements of that, it talks about as a region, HCC members will basically look at reconfiguring patient flow in emergency departments to provide isolation capacity for PUIs and COVID-19. So this is kind of some active things that they're looking for us to do throughout the remainder of the year. Examine physical infrastructure needs, which may include retrofitting and alteration of inpatient care areas for enhanced infection control, dining and doffing. So what does that kind of look like when we go to preparedness for our regional preparedness plan? What I can, from my perspective, and you guys feel free to chime in, and Greg, please feel free to chime in. That basically means that we're going to relook at our organizations, and you've already been doing that. So there's probably some areas where you expanded negative pressure space in your hospital because you found that as a gap in your organization. I know our good folks over at St. E's did that. To a certain degree, we did that with certain units. We turned half of an entire unit to a negative, pressure airspace, but there were some hoops that we had to jump through to do that. We also, as a lot of folks, expanded our ED capacity, our waiting room areas, by doing some form of retrofitting. We used tents. Some of you guys use tents and stuff like that. So this is what they're going to be looking at or looking for us to do as a coalition, identifying those areas and trying to put that into our planning going forward. Okay, what we can do expeditiously and expeditionarily, and then what can we do to try to do something that may be semi-permanent or things that we can do in the future years going forward. Much like what we discussed when we were when we started our earthquake preparedness and planning. We did those courses. We looked at areas where we could put in we looked at areas where we could better make areas safe across the hospital, and a lot of those aren't big purchases. They were small purchases or small things. Same thing here. What else do they talk about? Identify alternate care sites on facility grounds within close proximity and additional sites for subacute care patients to increase capacity. Again, re-looking at those things. So that was a thing. So really scrub that. But again, they gave us deadlines and we had to meet those. So at this point, I would like to just open it up. I know I talked a lot about how the grant has changed and how I see us moving forward, but I'd like to get a little bit of feedback from the team, from the folks online. What are your thoughts, and how would you like us to kind of move forward, or what are some things that we can put in our planning hats and how we can schedule kind of moving forward as a unit to make sure that we're meeting these new deliverables. Now, I don't want everybody to shout at it once. I know there were some crickets on here. This is one of those times where I see that normally John or Eric will jump in and say, hey, here, Phil, here's a lifeline.
Hey, Phil.
Hey,
This is
Rick, what's up?
And I know this probably goes without saying, but certainly whether it be the region or just each individual hospital, we're going through an exercise here in-house to, what did we learn from the last COVID, situation, from all the above, from policies being written to how we would improve those policies, who we would include in reviewing those policies, procedures for, making sure staff buy into the policies generated by the ICC. So it's a whole host of what I'm just calling, what did we learn, to dovetail into, a new, if you will, game plan going forward, which we anticipate for the fall. I don't know, if that helps you in any way, shape, or form. I mean, certainly hands-on experience to change it based on what you did experience goes a long way. And maybe as a group, we could certainly pick up tidbits from other sites that either we didn't anticipate or didn't even think of.
Thanks, Rick, for that feedback. So how would you like to see that us as a coalition execute on that? So we've done it here, you're doing it there. Again, you're doing your internal version of some of that, right? You're just doing your after actions, or we're not post emergency yet. We're still in the midst of a response.
Right.
But you're getting that feedback now. You're trying to look at, how do we, when we did this, when we put this tent up, was that the right thing to do?
I'd be happy to host, a meeting of sorts where we could come together, just to launch something so we get something moving in an effort to, it's like you start out on that journey thinking one thing and you end up doing another. But at least, we got some communication going regionally wide and in an effort to put something on in print.
Indeed. I do know that, you guys have done a great job with, meeting the needs of the patients in our community head on. I mean, that almost goes without saying, and I think about it almost daily of the work that everyone is doing. And this is something that, again, I would not want to lose in the end of it all. And while things do pop up and kind of change our course, after COVID in, 2021, there's going to be an asteroid or a solar event probably that's going to say, oh, our eyes will kind of go to whatever that emergency is. We'll respond to it and we'll get over it. But what I don't want to do is I don't want to forget all of the things that we kind of put ingrained. Like, I still don't want to forget I'm still trying to look long range. I don't want to forget the money and time we invested in planning and preparedness. I don't want to forget any of the pandemic planning that we got, even though, again, like I said, spring of next year, when the solar flare blacks out half of the continental United States, starting with the Midwest, that I don't want to lose all of our pandemic planning, even though that was the emergency of the week or month at the time. So I do see us having some group thinks, I don't know whether they're going to be workshops or what have you going forward. How much of this, and again, the feedback that I'd like to garner from, hospitals, EMS agencies, how much of this do we think that we can gather prior to in some form of Q&A and surveys? Because I do know that, these meetings like this that can go at, pretty far and wide ranging, they can be very long once we go into them. How much of this do you guys think we can get done via survey from your organizations? And do you think we'll be able to get some of your C-suite or administrative support in reviewing those, not just something that you're going to fill out, because I know it goes to you a lot of times if there's a request for information, but getting our C-suites together. Do you think this would be something that we pull IHA in to assist us with? So again, I'm going to pause for a second and leave the floor open for a little bit of feedback.
Hey, I may be shooting myself in the foot, and this is Rick again, but I'm just going back to the beginning of this COVID thing, but I quite honestly thought IHA was, following behind IDPH. They didn't really seem to come up with anything original. It seemed to come up a day or two after the fact, and, it was almost as if it was a repetitious kind of message. And I don't know if anybody else feels that way.
This is Eric, and
there you go.
I'm supposed to weigh in, Phil, because I don't want to disappoint you. So, first of all, I have to scurry off to another meeting, so I'm going to say my 2 cents. I think it would be a great waste if we didn't get together with the sole intent of, the people who do emergency preparedness at their hospitals. So most of us who are on this call. And actually have a frank discussion. And I'm not ashamed to tell you that I really get tired of people not talking and talking about or not sharing what they did as a facility during this, because we can all learn from each other. There is no right, wrong, or indifferent. The things, is there anybody else that thinks that the main thing that we really had difficulty with was supply chain? I think that is our huge concern moving forward. I think collectively or as a region, we did a lot of things together. And the other thing I want to say, Phil, is my opinion is talk to us. I think, in my opinion, when we start involving answering questions from the C-suite, the answers get very convoluted. That's all I'm going to say. Have a great day. See ya.
I appreciate the feedback and candor. Thanks, Eric. Okay. But these are things that I want us to be able to, I agree with Eric. And I agree with Rick. I do believe IHA was a little behind in certain instances. But one thing I do know is that anytime IHA sends out a survey, you can bet that my administrative team here wants to know if I fill that survey out or not. That it seems to for whatever reason pique their interest. So while they may not be the driving force of it, I would, I do appreciate what they, the attentive nature that they garner from our administrators. Now, I do know, to Eric's point, where it really counts, where the rubber meets the road, when we're talking brass tacks and what worked, what didn't work, that's going to come from the folks on the front line. That's why we started with our initial survey. And still got to do a little bit of cleaning up on that from our frontline staff survey. But that's going to come from there. What we can do, what I don't want to, as far as expectation management with these type of plans and get-togethers, what I don't want to do is kind of give everybody a false hope or thought that whatever we're going to do and we put in this plan is going to be something that is by all authority. This is what you will do when the next pandemic arises, or this is why didn't you do this? It's going to be a guideline. It's just going to be, it's going to be a pathway to meet the need the next time, to better meet the need the next time. It won't be a prescriptive, this is what you will do as an organization within this region. It'll be, hey, if you want to do things a little bit better, here's how we got, this is what we believe will help us, and it should be something that we can rely upon. All of the prescriptive stuff is going to come from the state, and your organization, or your county, or what have you, wherever you're at. So there are things that a region will never be able to fully solve. I think we work very well together, but we were not going to be able to, the region itself, we're not going to be able to say, we're going to have enough PPE within the region to last 90 days for all of the for 19 hospitals, yada, yada, yada. We're not going to be able to do that. But we can create, when working together, we can create better paths forward in meeting the need the next time. So I did receive a question, so I'll leave that there with you guys, and I hope that you guys can provide me some feedback on how you think we can best go about it. I do see some meetings, virtual meetings more than likely going forward, depending on how we continue to go in our phases. So one other thing that I did want to touch on this one, it says validate the pediatric surge annex. Scott did a lot of work on Scott Klosterman did a lot of work on our pediatric surge annex, the draft of that. Lee followed up with some work, and I did provided some oversight. So that plan, I would say, is probably, it's a draft, and it's probably 65–70% of what I think it needs to be. I'm going to be sending that out. I know I got a request, I think, from Brad this morning, hey, working on some EDAP stuff, what's up? Do we have a pediatric surge plan? I'd like to have that so I can, use it as reference, So we don't have one. We've never had one, but we will have one by September 30th. Come heck or high water, we will have a surge annex for pediatrics. And again, I want you guys to think of our plans, specifically, like say a pediatric surge annex. It's not going to be super prescriptive. It will move us together as a coalition, but your organization really takes on, I would say, probably 85% of the brunt of that. And then, the region itself maybe takes on about 5 to 10% of trying to support you in that endeavor, whether it's EDAP or some other certifying body. So hopefully what we'll provide is doable, something we can work with. All right, let's see. I think that's all I have with grants. I know that was a lot of stuff. Again, I have an upcoming event slide here, but there isn't a lot of upcoming events. We've canceled pretty much everything. I will say that we did, when you go in there and look at the regional MITEP in SIMP, you will see that we're looking to try to start back, just targeting starting back our decon classes in, I think, November timeframe. So depending on where we're at as a state. And Greg, I don't know if that's something that you want to talk about as far as what we're looking like as a state and any other specific stuff for phase 5 or what have you. But again, I would tend to think, as my son went to, I think, Gold's Gym or one of the fitness places, not Gold's, one of the 24-hour fitness or something or other. He went there and said they are out of control and inside of this fitness place. And he just said, he couldn't be in there with good conscience because it was just no social distancing, folks not wearing masks and breathing real hard. So if the other states are any indicator as to what happens when you get a little too free, with your movement and not wearing masks, the numbers go back up, and we can expect that. This state's done a lot of work to push the numbers down, and I'd hate to see it go left. And I can see us being in the position where we can't have large groups and be able to do classes. But with that understanding, we're going to be targeting November as a time where we start to see our face-to-face classes, even if we can keep them to 10 or less. And traditionally, we want 10 or more in our decon classes because that's a full 8-hour course, and nobody wants to be in a class that long without getting kind of our money's worth for it. So But if we have to, we have to. We know that there's still a need. You can still have, again, walk and chew gum at the same time. You can still have a hazmat incident and your patient's coming to you looking for your support, and you need to have trained, qualified folks there, and we want to be able to support you in doing that. So more to come. Anybody got any other announcements? I'm just going to open the floor. Questions,
Phil?
concerns? Yes.
So it's Greg. So I was just going to add on to that. Yes. So we moved into phase 4. It's going to be monitored. You know, as everything happens, you know, we go to phase 4, and now there's, you know, hundreds, if not thousands, of inquiries about what about this, what about that, what about this. So IDPH is trying to get guidance out. I believe we could move as quickly to phase 5, depending on how everybody acts, or we could move quickly back into phase 3. I don't think our governor, and I am not friends with Governor Pritzker. We don't have dinner together, so I don't know. But I don't think he has any problem in moving backwards if we have to. So yeah, it's very it's a little scary to see how we move forward, and IDPH is trying to get guidance out to everybody as quickly as possible on all of the special circumstances that they're getting. The other thing that I would say on the pediatric annex, I have always felt in our region that we have this kind of feeling that we can always depend on St. Louis. But your EDAP and CDAP surveys are coming up. That is not IDPH's stance. IDPH's stance is, what do we do if we can't depend on St. Louis? So when Phil sends out this annex, please read it. Please give feedback to it. Please understand it. So when you have your CDAP and your EDAP meeting, you know, you will be able to explain how your facility will be participating in all of that. Those start in August. So I'm just letting you know that the answer that we'll just send everybody to St. Louis is not going to be an acceptable answer in these surveys. So, and there is a separate emergency preparedness component of those. So just get yourself prepared. And that's all I have.
Thank you, Greg. Yeah, that is I mean, we talk about it a lot, you know. We know that we don't have a deep bench when it comes to inpatient pediatric side of the house. So, you know, when your EDAP folks come in and say, hey, how many cribs and isolettes and do you have? And they're looking for those things. They're trying their best to try to prod us to be more prepared for the large pediatric scaled emergency. Now,
right. And if everybody doesn't know, I think we are now down to 12 licensed pediatric beds among the 19 hospitals that are in our region. That is really low. And those beds are all on adult units. So I'm sure they don't get a lot of experience in pediatrics. So it is going to fall on the EDs and the emergency preparedness folks to ramp up those types of temporary services in some kind of disaster that would require pediatric children to come to our hospitals over here.
Thanks, Greg. So yeah, when that goes out, please, by all means, take an opportunity to read through it. And I'll ask you, when you read through it, look at it through the lens of, how does this plan help us respond better as a coalition to a pediatric disaster? Okay. How does the plan, how is what's written here help us respond better, or help prepare us better for pediatric emergency within the region? please think about it from that lens. All right. Anyone else with anything?
Phil, it's Tina, and I just have two quick things.
Yes, ma'am.
And if you said it, I missed it, but the decon courses coming up, are those still, we're not going to be doing those like for August and further at this point in time?
Correct.
They're already scheduled? Okay.
Correct. Ones that are scheduled, and we're trying to target November as the restart date. November being the restart. So
All right.
More to come, but yeah, November is going to be our target.
And then the second thing is that our Joint Commission survey is due the first week of August, and so the Joint Commission did notify us 2 weeks ago, did make a preliminary call, and then they did call us last Friday, which has been 2 weeks. We are scheduled, and the only thing, in case anybody wants to know, that they asked was they wanted to know about if we had any PUIs that was currently in the facility, one if we had any recent positives that was reported in the county or we had in our organization, asked about the waiver 1135, our conditions of participation, and I forget what else. And so they will be here. That was last Friday we had the call, so they'll be here either the week of the 13th or the 20th.
Thank you for sharing. Anyone else? Okay. As always, thank you guys for what you guys are doing across the region. And we will talk to you next week. We do not have an afternoon call today. This will suffice for that, but we will still maintain our Wednesday afternoon call for our hospitals, but any and everybody is more than welcome to join on that one. And that's a line that always works. We don't have any problems with that line, just this one. So talk to you guys next week if I don't talk to you sooner.